You are so You see that? I done messed up.
I can do this for hours and hours, hours.
Hate your life, plan it out. You can go as far as you can dream. Edges laid, curls popping. She's a doctor of pharmacy.
Hey y'all, and welcome back for another video. My name is Bianca, also known as Dr. My Curls, and today we are going to be doing a get ready with me as I spill the tea, have story time, and give y'all some pet peeves of mine as a pharmacist. So if you're interested in joining the conversation, primarily y'all, because I'm not a makeup artist, then stay tuned. So I am starting on freshly cleansed skin. I do have my moisturizer on, my serum, and all of that good stuff. I do have acne prone skin, so we do have some blemishes that we need to cover today. And yeah, so let's go ahead and get started. First, I'm going in with the Everyday Humans Resting Beach Face SPF 30. Don't forget that Nexus. Alright, so if you are brand new to the channel, I am a pharmacist and I've worked in a variety of settings, okay? I've worked in hospitals, community pharmacy settings. I worked in, which is like Walgreens, CVS. I worked in a clinic, so like a physician's clinic where you go to get your checkups. Some of those clinics have pharmacists. I worked in that type of setting. A lot of different settings. What I just went in with is the Banana Bright Face Primer, which has vitamin C and banana in it. Old Henriksen, I think is how you say this brand. Y'all see it. And let's go ahead and get into the details. So the first story, girl, I had to write them down because it's just so many from different like pieces of my journey as a pharmacist that I had to make sure I didn't forget them. So the first story, y'all, let me see because I'm looking on my list. Okay, so this one is from a community pharmacy setting, so Walgreens, CVS, that type of setting. So this particular day, the patient called the pharmacy and she wanted to know how much her medications were going to be. So no problem. Usually if we need to figure that out, we just look them up in the system and go from there, right? So we looked the patient up in the system. She's a brand new patient, i.e. we don't have any of her information. We don't have her insurance, her name, nothing, okay? Going in with the Estee Lauder, excuse me, double wear, stay in place makeup. Promise I'm gonna stop telling y'all what I'm using. I might just link everything below. So anyways, she is calling the pharmacy, telling us I have Blue Cross Blue Shield and I need to figure out how much my medication is. So I was like, well, ma'am, we have to put it through the system in order to give you a price. That set little mama off, okay? Like, we don't know the price of your medication. If you're watching this and you also thought that pharmacists knew the prices of all medications, that's a myth, baby. We don't know. There's no way for us to find that out. I told her, you can call your insurance company directly and they can let you know the price of it. I said, but I'm so sorry. I'm unable to do that unless you have your insurance information. What? You are so incompetent. You are so incompetent as a pharmacist. Why do you not know? Going off on me, y'all. I'm laughing about it now, but in the moment, if any of my team is watching this, y'all remember that day. Like, I was shaking. After she had her little 2 cents, she hung up on me, y'all. Like, excuse me, ma'am. Like, please, do not call me incompetent, number one. Number two, I'm trying to help you out. Like, I was like, ma'am, if you give me the insurance information, like, and give me a minute, I can run it for you. She won't try to do all that. Like, I cannot pull this number out of a magic hat, sis. I am not a magician. So the next patient, again at the same setting, I was the pharmacist at the closest window to the patient, and they came up and they were basically saying that they needed something. Like, I could tell it was something like in an area that they were kind of ashamed of. I stepped from behind the counter. Girl, hold on, cause you see that I done messed up. I'm gonna be right back, y'all. Alright, y'all, sorry, this is my first get ready with me, and I know next time to not even bother with the brows on camera. But after I'm done, I just go in with a little bit of aloe gel. I wanted to bring him to the side because I could tell it was a sensitive topic, right? So when I call him back, I'm like, okay, so tell me what's going on. He proceeds to pull his pants down. Y'all, I said, ho. I was like, no. Like, I did not pull you back here so that you can show me. This is not your doctor's office, sir. I'm not even lying to you when I tell y'all I was no more good. Like, no more good. Thankfully, I stopped him before he exposed anything. But I'm like, sir, hold on. People literally think we are their physicians and this is a physical assessment. Like, baby, I'm not. No, ma'am. Girl, I said, not you pulling down your pants. I'm forgetting everything. I think it's just the brows. Like, obviously I need to do my brows off camera. Like, y'all, we back. So I'm just gonna blend this in, my concealer in. So look, we on to the next story, okay? So this story happened in a clinic setting, okay? In this type of setting, as a pharmacist, I manage diabetes. So I meet with patients one-on-one in an exam room and we talk through their diabetes, or I call them on the phone and check in with them to see how they're doing with their numbers and all that good stuff. So a mixture of both. These patients are assigned to me by their doctor, okay? So I had a patient, told him what we're going to be doing, working on his numbers, this, that, and the third. So we've been working together for like 3 or 4 visits, and Valentine's Day was coming up. So he was like, I'm so thankful for you. You've helped me with my numbers. I want to tell you thank you, so I want to get you something for Valentine's Day. And so my patients will sometimes do that. Like, they'll get us stuff to say thank you. They'll bring us lunch. Little gestures, girl, I can't talk. Gestures like that. I'm just going in. This foundation is buildable. By the way, I don't have a lip on yet, but my lips are definitely giving pink. So I was like, oh no, you don't have to do that. Like, I want to help y'all, meaning all my patients. Like, that's what I'm here for. The thought counts pretty much. So he was like, no, I want to get you something. One of my friends makes these baskets and I really want to get you something. So again, I said, no, it's fine. So fast forward to the week of Valentine's, right? So I'm in the pharmacy and the patient comes in with a basket. So my boss is like, Bianca, you have someone here for you. So when I go outside to see who it is, y'all, this man, I lie to you not, had a 5 foot, okay, bear in his hand. The bear was from my head to my knees, and I'm 5'7". I'm not even lying to y'all. A huge bear and a big basket of stuff, and y'all should have seen my face. I'm like,
oh, thank you. Awkward smile.
Takes gift basket, because one thing about it, I am not turning down anything. And that's just that. So I took the gift basket from him, and he had a card too. So when I went to the back, the clinic would have thought that me and this man were married, okay? Meanwhile, I do not know who this man is. I do not know this man.
To say it, I hope I don't sound ridiculous. I don't know who this man is. I mean, he could be walking down the street. I wouldn't know a thing. Sorry to this man.
So I go to the back, and y'all, in addition to the big bear, child, let's have an intermission here, okay? Y'all comment below, let me know what else y'all think was in that basket while I put this concealer on, baby. What y'all done guessed? Hold on. Not only is the bear in there, but I see a VS. And all the girls know what VS is. And I said, hold on. Y'all, come to find out, this man has 2 Victoria's Secret sprays in there. Okay, the little set. And a Victoria's Secret bag, like a travel size bag that you could put your makeup, your lipsticks, that type of thing in, your skincare. And candy, and this big bear. Like, I was so shocked. Y'all, I ain't even gonna hold you. I thought it was gonna be something inappropriate in there, for real. like some lingerie or something. Not even gonna hold you. So girl, I cannot even. That story to this day, people that work with me, we always it came up so many times after that, because it's just like, he was really serious. Never forget it. Right now I'm just going in on top of my contour with the powder. So I have this powder from Sephora, the matte bronzer. Alright, so pet peeves, y'all. Let's move on. My pet peeve is when a patient calls the pharmacy, okay? They need refills of their medications. Cool, no problem. We can help you with that. The piece that gets me is when they say, when we ask like which medications or what medication do you want to refill, and their response is all of them. Half of them they don't use, they don't get filled. Like, I'm not about to go through your profile and fill every single medication for you. No ma'am. Because the thing about it is, when we fill 6, 7 medications, it's always going to be the little nephew that comes to pick them up, takes them home, and grandma's like, I need all 7 of these. Well ma'am, you told me you needed all of them. So therefore, moving forward, I personally do not, if you tell me you need all your medications, I then come back and say, okay, what are the names of them? What are they for? It's one thing if you don't know like how to pronounce your medications, but if you say, oh, my blood pressure medicine, then cool, we can get somewhere. You know what I mean? But for you to just say all of them, so I'm just going in and blending under my eye. And the concealer was from Juvia's Place in the number 15. Definitely does it for me. So I'm gonna blend it in. I know it's looking kind of like cool. We're gonna blend it in, but that's the first pet peeve. The next pet peeve, love y'all to death, technicians, but a super technician. Like, baby, you are not a pharmacist. So let me explain what that is. A super technician is a technician who thinks they know everything. They've been working for the company for X amount of years, and they just feel like they can make recommendations. They can call in prescriptions. Like, I know some states do allow technicians to do certain things, but I'm talking about the states that don't, and the technician still feels obligated or inclined to proceed with stuff that they know they're not supposed to be doing. So if a patient comes up and says, hey, my daughter has been having a cough, or I'm having a cough, what should I take? The super technician would proceed to say, not grab the pharmacist, but proceed to say, oh, go ahead and get some Robitussin Al 5. Like, ma'am, there are questions that we need to have, conversations that we need to have. Like, what if they have diabetes and you done sent them to get some Robitussin and now their sugar is through the roof? You know what I mean? Like, what if it's a dry cough and it's because they're on a medication that's causing that and we need to stop the medication, but you done sent them to Al 5. So that really grinds my gears, because I feel like just because you work with the company for X amount of years, granted, I love my technicians. Like, hear me when I say I appreciate my technicians, love what y'all do. If you're watching this and you're a technician, the show can't go without you. So definitely appreciate you, love y'all to death. However, you need to learn your boundaries, and I just feel like some technicians don't know their boundaries. I ain't gonna get no further into that, but get into me, okay? We're getting somewhere, we're getting somewhere. We move, okay? The other technician pet peeve that I have is a rude technician. The patients will be ready to pull up on you. Like, I had a patient tell me, meet me in the parking lot. Meet me in the parking lot. Not me, excuse me. The technician. He told the technician, meet me in the parking lot. And I said, hold on. Like, what's the issue? What's going on? I had to intervene because I'm like, y'all not about to meet. Oh, shoot. I hate when I drop this stuff. But I was like, y'all not about to meet my technician in the parking lot. Like, what's going on? Why do we need to pull up? And we ended up, like, one thing about it, I can de-escalate a situation. So we ended up laughing it off. But, girl, these patients are about that life. Like, depending on what store you work at, yeah, they about it.
I mean, I want to tell him everything I've been feeling about us lately, but I just...
'cause I know you won't do the same. And I'm so tired of trying to get through. Why you acting like it's a game? It's not funny when you try to change.
Please, please, please know I love my job. I love being a pharmacist. These stories actually keep me going. So I hope y'all got a good laugh. So yeah, I hope y'all enjoyed it. Y'all know I can go on and on and on and on and on. I can do this for hours and hours and hours.
I can do this for hours and hours, hours.
I can do this for hours. All right, y'all. See y'all on my next one. Bye.